what I what I think changed the most is the speed at which otology is moving from purely surgical and diagnosis specialty toward a more integrated and more personalized, technology-driven field. In a few years, we've seen major progress in imaging, in endoscopic ear surgery, cochlear implantation, auditory implants, and vestibular assessment. And now we're no longer asking, is it possible to treat a disease? But now we are asking, can we treat it earlier, more precisely, and with less morbidity, and with better outcomes for the patient? Another major change is the way we think about hearing itself. It's not only about ear, it's about language development, cognition, education, social inclusion, aging, mental health, and quality of life. So now this broader view is changing how we manage the patient, children, adults, and elderly patients. And there also been a cultural change in otology. We are seeing more collaboration between surgeons, audiologists, neuroscientists, engineers, and industry partners and humanitarian teams. And that's this multidisciplinary energy that is exactly what IODA is about. And now from Cape Town 5 years ago to Rome this year, IODA has grown with the field. It reflects a specialty that is becoming more precise, more global, and more patient concerned. All three are very exciting, but if we speak about the next 5 years, I think artificial intelligence will probably have the broadest real-world impact on the largest number of patients. Gene therapy is absolutely fascinating, and it may transform the future of some forms of genetic deafness. As you know, we're already seeing encouraging clinical advances, particularly in specific genetic conditions such as otopharyngeal relating hearing loss. But in the next 5 years, this will still concern just only a selected group of patients and in very specialized settings. And robotics, it's also very promising, especially for precision, reproducibility, potentially less traumatic cochlear implant surgery, for example. But again, its adoption will depend on cost, access, training, and proof of long-term benefits. AI, however, is already entering daily practice. It can help us handle our administrative tasks today. It can help us analyze imaging, support the diagnosis, personalize the hearing aid and cochlear implant programming, predict outcomes. So I think it will not replace clinical judgment, but it can make care faster, more consistent, and more individualized. So for me, the question is not which technology is the most spectacular. All three of them are spectacular, but which technology will reach patients sooner and at scale? For me, the answer is AI. Because it has the most immediate impact. While genetic therapy, for example, we may have the most revolutionary long-term potential. Hearing loss is still underestimated because it's often invisible. It doesn't always look like an emergency, but the consequences we know are profound for the patient, but also for the society. But IODA can help change the perception of hearing loss by bringing scientific excellence together with public awareness. A congress like IODA is not only about sharing surgical techniques and presenting research, that's part of the job also, but that's not only what we want to do. We want to bring together people who are interested in this field of hearing loss and have ideas, are conducting changes, and are aware of the impact of on the hearing loss on the population. And IODA is a congress that gives visibility, I think, to the diversity of the hearing loss, to the different populations that are affected, babies, children, the working adults, the elderly people, the vulnerable population, and the consequences that it leads to, like on the education, on the communication, on the mental health, on how the people are aging. And when we bring in one congress together many scientific persons, many scientists, many physicians that work on this field, it's really interesting because it creates a community of professionals that who carries a message beyond the Congress to hospital, to university, to patients, to the public. The most important aspects of the IODA. That's what we wanted to do at the beginning. We wanted to make people from different countries with different experiences, from different kind of exercise, from the private practice, from the public practice, and to make them speak about their experience. And that's really interesting, even not only on one field, if I think about pediatric otology, but because you have to stay in the room all Congress long, you have to change the subject, and sometimes you have to listen to something you don't practice every day, and that's really interesting because you can still be aware of what is evolving in different aspect of our work, what my colleagues are doing that I don't know because I'm very focused on what I do, and the fact that we have to share our experience and to be able to change from one topic to another one, it's really interesting because it gives us the opportunity to learn something new and to stay aware of on the evolution of the field of otologic surgery or otologic practice. The idea I would like everyone to live with is that the future of otology will only be built by technology alone. It will be built by connection between physician, connection between surgeon, audiologist, engineer, industrial partner, and I want them to understand that it's really important to meet in person. It's something to learn on webinar on internet because you can of course stay aware of what is new, what you have to learn. But it's really important to come to physical congress, I think, because it's really interesting to share your point of view with someone else, and especially if they are coming from different countries, because you realize that what you do is absolutely not what the other one are doing. And um, because of the type of congress IODA is, it's really easy to speak with the speakers and with the attendees. So it's I think the best way to understand how the world is evolving and how we can pick some ideas everywhere to improve our own practice.